medical rehabilitation is something that can probably best be understood by thinking of Congresswoman Gabby Giffords, thinking of Chris Reeves, thinking of high-profile people who have undergone pretty significant injuries or have attained or acquired disabilities or chronic conditions of some kind.
We are very fortunate that we've had this opportunity to treat Congresswoman Giffords since last January, and I'm sure you've seen her picture in the newspaper. She looked good. She's a hard worker, and that's one of the reasons why she's also accomplished so much in those 4 months. So people were asking me, 4 months, the only reason she got that is that she's an important person. So guess what? When I was in training, I had patients who stayed for almost a year. 4 months is nothing, that's short. The program that we designed for her is pretty typical. It's not just multidisciplinary, it's interdisciplinary, where all the members of the team, the various therapists, nurses, and physicians work together towards a goal. We met every single week. We set goals, short-term goals for this week. She recovered more than what we expected, so we had to change the goals and upgrade it. So it's a continuous review of the person's progress. We have to pay for quality. Quality comes at a price, but the important thing is that we manage that price that we're going to use, that we're going to employ in delivering healthcare. There has to be partnership. I think the best outcomes is when everyone is working together, and that goes beyond the healthcare system. We have to educate the public. We have to educate the policymakers about brain injury, about rehabilitation in general, and what value it adds to recovery. As I mentioned earlier, the developments in acute care, in medicine, and in surgery have extended lives. We have to add value and quality to those lives, and that is where rehabilitation plays a